Thank you, Mr. Speaker. Mr. Speaker, last Friday, November 8th, the Department of Health and Human Services announced that the new Medicare Part B premiums for starting in January 2020 will increase by $9.10 a month, a 6.7% increase over last year. In dollars and cents, this means that premiums will go to $144.60 a month, up from $135 a month. As seniors know all too well, that $144 will be deducted automatically from their Social Security checks, which is a bitter pill, given the fact that Social Security itself is slated only to rise by 1.6% starting in January 1st. Very simply, that $9 a month increase for millions of seniors will chew up a large part of any COLA that they can possibly receive starting in January. So, Mr. Speaker, I just want to foot stomp that point about the fact that the Social Security system's COLA, which is tied to general inflation in the economy, is going up 1.6%, whereas the Medicare Part B premium, which is tied to health care costs, is going up 6.7%. This is something that we know is endemic throughout the healthcare system. In the state of Connecticut, the Department of Insurance increased commercial insurance rates that went up again above inflation and identified the fact that prescription drug costs was the primary cost driver. The Center for Medicare Services last Friday, when they announced the Medicare Part B premiums, also confirmed the fact that it is prescription drug costs which is driving that 6.7% increase. The increase in prescription drug costs that Medicare paid from 2018 to 2019 was 10%, and they are projecting that it's going to go to 10% in 2020. Thus, we have a $9 increase coming up in terms of people's premiums. This is not going to come as a great surprise to the American people. If you go back to last year's election in 2018, the exit polls showed that the number one issue that people cared about and were concerned about and that wanted Congress to act on was health care costs, more specifically prescription drug costs. That was an election that had the largest voter turnout since 1914 in a midterm election and elected a new majority with a 10 million vote plurality. So that's the context that we're in right now at a moment where this Congress, and particularly the House of Representatives, is poised to take up H.R. 3, which is the Lower Drug Costs Now Act, which, again, in the midst of all the media focus on impeachment, it is important to know that the committees that have cognizance over health care, the Ways and Means Committee, the Energy and Commerce Committee, and the Education and Labor Committee, which I sit on, reported out basically the same version of H.R. 3, and it is, again, a matter of just a couple of weeks for the Congressional Budget Office to finish scoring the bill that we're going to take up that measure for a vote. What does it do? It basically unhandcuffs the Department of Health and Human Services to negotiate with the pharmaceutical companies. By law, they have been prohibited with what's called the non-interference clause with negotiating lower drug prices. The VA system has been negotiating prescription drug costs for decades, and in fact, they get a much better price for veterans in America than the folks who again, are covered by Medicare. So that non-interference clause is going to be scaled back. DHS is going to be able to negotiate the 250 highest brand name drug costs tied to an international price index, because America pays the highest drug costs by far. The next highest country is Switzerland, and they pay 25% less than we do here in the U.S. And again, what does those savings mean in terms of folks on Medicare? Already CBO has told us for people who are on Part D, which is the outpatient prescription drug benefit, they, again, are going to see a reduction in the out-of-pocket costs, which today are unlimited in terms of any co-payments that they're paying for medications. That will be capped at $2,000. I have a constituent up in Killingly, Connecticut. She's a retired teacher. She has AFib. She's on Medicare Part D. It's been a great help to her. But those co-payments, because the AFib medication is so expensive, cost her $13,000 a year. That will be brought down to $2,000 a year if we pass H.R. 3. And that is just one example of the benefits. $350 billion in savings to Medicare over 10 years, according to the Congressional Budget Office. Again, this is a program, Medicare, which is slated to go into negative territory, according to the trustees, starting in 2026. We are giving a $350 billion lifeline to Medicare to make sure that is an enduring program moving forward in the future. So that's why organizations like AARP, the National Committee to Preserve Social Security and Medicare Network, the Lobby for Catholic Social Justice, Patients for Affordable Health Care Now, and the small business majority are supporting H.R. 3. It is time to sit up and pay attention what just happened last week to Medicare and pass H.R. 3 for America's patients and seniors. I yield back.
The chair recognizes the gentleman from Texas, Mr. Roy, for 5 minutes.